Thank you very much, Sarah. I'm happy to present the progress that has been done by Africa CDC towards building the Africa Pathogen Data Management and Exchange Platform. So looking back in time, 2019 and early 2020, the onset of the global pandemic, SARS-CoV, led to Africa CDC working with the partner, that's WHO to build the sequencing network. As you can see it here, we had to utilize the facilities that were already established in this space to ensure that the continent was in a position to do the sequencing. So Africa CDC did the operationalization of the network, working with WHO coordination, leveraging on existing capacities, and also ensuring there was access to the sequencing platforms and the technology. But of course, as time went on, data sharing and access became a big issue. So at least as we talk, we have each of these countries able, out of the 55 countries, 53 of them are able to sequence locally within their boundaries. But initially, it was managed through this network. Countries that were not able to sequence, they are referring their samples to each of those regional sequencing hubs. And then we had also the specialized genomics facilities that were involved so much in the capacity building, as well as the training and support. So over time, this network has been functional, but many of these laboratories have moved to different levels. Many of them are now at a regional level that were initially at a national sequencing facilities. And then we have emerging opportunities that are taking advantage of the infrastructure you are seeing here in the network. One of them is the Genomic Centers of Excellences that we hope will be coming soon, starting early next year. And also, as you have seen at Bebo's presentation, many of these countries have developed the national multi-pathogen surveillance strategies where they are incorporating surveillance of pathogens of priority within their national programs. And these examples include surveillance of drug resistance in TB and HIV, as well as diagnostic and drug resistance in malaria. So this investment, as I've already talked about, 53 member states are able to collaborate through the network I've talked about. And then we have distributed over 70 NGS platforms across over 42 countries of now, and we're still going on. Reagents for worth 300,000 SARS-CoV genomes and other pathogens have been distributed. And we have managed to sequence and shared at least 170,000 SARS-CoV genomes through the GSAID portal. And over 700 individuals have been trained across over 52 member states. So 2019, that was the number of countries that had functional NGS capacities in Africa. 2023, as we talk, the map is getting greener. And the countries that you see that remain in purple, we are yet to establish capacity in the national public health facilities. So 39 NGS capacity, 39 countries and national public health facilities have functional NGS capacity. We have 9 where we are building capacity, and we hope we'll be able to make this a reality by end of next year. Yeah, so we deserve a clap. And as we conclude this slide, most of these national public health laboratories are now able to do sequencing and basic analysis of different pathogens of interest. But of course, as you go back in time, then in 2019, you see how many countries had functional NGS capacities in their national public health laboratories. 2023, the picture has changed and their demands have changed. You have seen Abebo's presentation. They're now looking at having a NovaSeq delivered by end of next year. So their demands have now changed from, can we have sequencing capacities? It is now more of building capacity for analysis, and that is something we are trying to address. Of course, as we are trying to address that, we realize also the needed capacity for the data infrastructure. As we are trying to respond to that, they also said the speeds of the internet are so slow. So these demands are coming in, and we are trying to be very accommodative. So each of those labs you have seen has at least, if you saw Abebo's slide, at least they had some of these as far as promising to deliver the NovaSeq platform. So each lab, some of them have both ONT and Illumina platforms ranging from MK1C. Some are blessed that they have even the NovaSeq X series, like Christian Happy's lab in Nigeria. So the problem now comes in with the amount of data that comes off these platforms. If you can see here the ranges of this data, the maximum can deliver up to 14 terabytes of data in a run. And if you look at also the NovaSeq down here, it can deliver up to 6+ terabytes of data in a successive run. And of course, like I said, their demands are changing with time and space. And they don't have one, like I've already said. Many of these have a range of these platforms, and they decide which one to use. I can see Placid is here. He has a number of these platforms. So depending on the need, they will always choose to use either ONT or the iSeq, MySeq, or NextSeq, depending on how large the project or the number of samples they want to sequence. But also looking at the supply chain issues down on the continent. Sometimes you run out of the ONT reagents and you can use the Illumina reagents. So each of these labs doesn't have one platform. They have a range of these and a combination of these. So looking back into time, 2020, how many labs were able to sequence? There are less than 10 from Africa. So that was almost at the onset of the pandemic. And then 2021, Africa PGI started in around March 2021. You can clearly see the increase in the amount of SARS-CoV data that came off the continent. And I think at that time there were about 32 countries that were able to do routine SARS-CoV surveillance. 2022 last year, countries generated up to 81,000 SARS-CoV genomes. And these were also shared on GSAID platform. Of course, we sat down and did an estimate, and we anticipated if there wasn't a change, if we had to work at full capacity, in a 5-year gap, we are estimating about 3.6 petabytes of data. But of course, none of the countries and the facilities you have seen on the continent has capacity to even host or store any of this data. But of course, as we know national requirements, there's no way you're going to sequence this data right from the sequencing machine and push it into the cloud or any other repository. So there's time you need to hold on to this data, do some preliminary analysis, inform the public health policies or decision making, and then later release this data. So this problem was imminent after 2022 that we needed now to respond to a new emerging challenge that was managing the data coming off the instruments. Yeah, so things have changed along the way, like I've already talked about equipping these. We have said over 79 platforms have been delivered, and we continue to work on the supply chain issues regarding access to reagents, building capacity for, the easiest, like you saw the presentation from Turkey. It is very easy to train people to do sequencing, but you will not train people to do the bioinformatics analysis and interpretation as quickly as you can for sequencing. So this challenge continues to hang around our neck, but of course there are some other challenges. You train people, as you have seen at Bebao, there is no salary scale for them. They will disappear eventually. And then you have to keep training. So don't ask me where are all the 700 people who have been trained. Many of them have gone where things can be much better. But of course we continue to train and see that we have at least some stable or basic capacity at each of these institutions. Okay, so now data governance and infrastructure, which is the gist of this presentation, and then beyond, we are now looking at beyond COVID-19. Many of these countries are now sequencing priority pathogens in each of their national public health institutions. Many of them have developed the multi-pathogen genomic strategies, and they are looking at us to see that we can support the data management systems in place, of course, depending on each of these national requests. So TB, HIV, and malaria have already jumped on board, and we are looking at also supporting sequencing of vaccine-preventable diseases. We have sporadic outbreaks for measles, measles, polio in some of these countries, and that is something that we're also keen to bring on board. So data governance, like we said, when we were reviewing our request, we realized it was key, and we came up with a request to develop the pathogen data sharing and archiving platform. And a list of other needs that we continue to respond to, you can see them there, but specifically data comes out on top. and also other requests like increasing their access to internet bandwidth. So we have worked on developing what you're calling the African pathogen data sharing and archiving system that is currently being developed at Sambi, here in the same city where we are, led by Professor Alan. And this will ensure that we try to respond to some of these requests associated with the amount of data that is coming off these countries. So we'll be able to provide an interface that can provide open source bioinformatics tools that can be utilized by each of these labs depending on their requests. We'll be able to deliver this within this platform, and also temporary storage of data until they are ready to get authorization to share it outside the country borders, and any other file management systems and utility software that can do a number of processes, including visualization. And then we'll be able also to empower or ensure that we have like plugins that can enable long-term storage through the international nucleotide sequence databases. So that is a platform, and that's what it is promising to deliver. I can say we are now done with the development of the prototype, and the next steps will be trying to take it to the countries, ensure we do engagement, training, and also get feedback regarding what else we can do. But I think where we are, the development is done. Next year, if all goes well, we'll be going to each of these countries and do the piloting. So this is how it looks like. The interface looks like this of the prototype, and so far these are some of the files or the samples that have been uploaded. Okay. And that's the timeline. Thank you very much.